physical therapist at Complete Game Physical Therapy. We are a small, privately owned physical therapy clinic located in Lowell. Just so you guys kind of know, from here, came from the clinic, took me about 12 minutes, so it's pretty close to here. It's right over by the Rourke Bridge. If you know where the temple is, we're set back right next to the temple by the Rourke Bridge. So tonight we're going to be talking about arthritis care and staying active with aging. It's going to be pretty informal. If anyone has any questions throughout, please just raise your hand, or if I don't see you, just blurt out the question and we'll go that way. Questions will definitely make this go a little bit better. Definitely wanted more of a discussion than a straight lecture. I prefer it that way. So let's get started. All right, so some objectives for tonight's lecture. We're going to start off, we're going to discuss some basic anatomy of normal, healthy joints. Then we'll hope that you guys will understand osteoarthritis, what it is, the signs and the symptoms associated with it. We'll review some conservative treatments for arthritis. We'll discuss joint replacements, and then understand the basics of joint care and arthritis prevention. And that will kind of be at the end. So getting started. So normal healthy joints. So joints consist of two bones, and it's the articulation between those two bones. So it's where your bones meet, and you have to have a place to bend, right? They're not all just stiff, you have to be able to bend. So you have two bones, they meet, and at the end of the bones you have something called cartilage. There's different types of cartilage, and most of your bones are going to have what's called hyaline cartilage, which is a smooth cartilage. If you ever eat a chicken leg, and you see that kind of the end is that white, shiny end of the bone, that's that hyaline cartilage, and that provides a nice, smooth surface for your joints to glide on. They provide shock absorption, especially in your legs, the joints in your legs. When you're walking, it provides a little bit of cushion, so it's not all just rigid. Talked about articular cartilage, and then going forward, there's some risk factors for degeneration. So you have both modifiable and non-modifiable risk factors. So what a non-modifiable risk factor is, starting off with things that you can't really control. So your gender plays a role into it. Arthritis tends to be a little bit more common in women than men. Your age, another thing you can't control. As you get older, regardless of your gender, your risk for arthritis increases. Also playing into that is genetics. There's a genetic component to all types of arthritis. Tonight we're going to be talking specifically about osteoarthritis, which is the general breakdown of the bone over time, but then there are other types such as rheumatoid arthritis, psoriatic arthritis, all have more of a genetic component to them as well. Then you have your modifiable risk factors. Getting into that, your weight plays a big role into that, and we'll discuss that further. Any previous injury or joint injury can play a role, but these are all modifiable. Also, an infection can lead to arthritis. And then occupational hazards. If you're in a job where you're constantly squatting down, a plumber, someone working with their hands constantly, electricians with their shoulders is very common. So kind of going through these pictures here, we're talking about this here is your knee joint. You have your shin bone down here. Up here is your thigh bone. And then right in here is that articular cartilage. See how it's nice and smooth, and it kind of glides right on the meniscus below it. You have your normal joint space here. On an x-ray is the number one way to detect it. Nice gap in there. That black is a nice gap. So it can happen in any joint in the body, hands, feet, knees. Most common in your weight-bearing joints, which is going to be anything in the lower part of your body and your spine as well. So that's your hips, knees, ankles, sometimes in your feet as well, and then your spine. Some symptoms, you have swelling, redness or warmth around that joint, stiffness, crunching with or without pain with that crunching. The stiffness tends to be more in the morning or after you're sitting down for a long time, you're inactive, and then when you go to get up or move around, you're going to feel that stiffness and tightness. But then as the joint kind of moves around a little bit, loosen up, some of that stiffness might go away. Any questions?
So if
Yeah.
I get it right, arthritis is the damaging of the bone.
Yep, so we'll get into kind of the specific types here. So osteoarthritis is what the focus is going to be on tonight. So it's the most common form of arthritis is osteoarthritis, and this is your wear and tear arthritis, right? So over time, be it from constant motion, you're constantly bending down, the bones constantly rubbing against each other can cause some breakdown over time. And if you see in the picture on the right, you have that nice smooth cartilage, and then over time, as you age, if you have an injury to that joint, you can break down and it's no longer smooth, right? You can develop what's called bone spurs, which can be like little calcifications where the bone's trying to heal itself because of an injury, but now it's no longer smooth, it's sticking out. Yep. Typically comes on slowly over time, right? You might say, my knees are aching, and then it gradually increases, right, as that arthritis starts to worsen. This doesn't mean that you can't wake up one morning and be like, my knee is killing me. You go to the doctor, they tell you it's arthritis. What happens with that is because it's wearing out over time, you have what's called your pain threshold. So if you're thinking about like an alarm system, if your pain threshold's all the way up here, and we have arthritis, and it's slowly building up, you're inching, and then you can go over the top, you wake up that next morning, my knee hurts. So it doesn't always have to be a gradual increase. It can be that sudden, I don't know what I did, my knee hurts. That could still relate back to the arthritis.
So this has to be, there has to be cartilage loss before that. Otherwise, that will keep the bones apart.
Yep, yeah, so it's the breakdown of the cartilage over time, be it from just general wear and tear, an infection can play a role into the cartilage, or an injury directly to the cartilage, where you fall, you break your arm, and it breaks through the bone, like through the joint, and you have a break in the cartilage, can wear it down. But yes, it's the damage of the cartilage is what arthritis is.
Is that always what happens at your knuckles?
It can be.
Working in computer,
Right. It can be in the knuckles. The knuckles. Yep, exactly. And that can, the knuckles are the most common place for the rheumatoid arthritis to present as well, which has more of a hormonal response to it, and the cause is more hormonal than just that general wear and tear. But yeah, absolutely, that kind of thickness in your knuckles, right, is constant use over time. The breakdown, and then they kind of swell up. The joint themselves can get enlarged from those bone spurs as that grows.
That you said is rheumatoid arthritis, or is it osteoarthritis?
It could be either. Yeah. I mean, if you have rheumatoid arthritis, it's very common that it presents in the hands. But that doesn't mean that if you have arthritis in your hands that it's rheumatoid. But
So if your muscles are not able to support the weight, the joint is the one that's going to bear it.
correct. Yeah. And that's kind of all the conservative treatments that we will get into. Yeah.
I'm just sorry to ask this question,
Yeah.
but if you don't have any more cartilage and you've got bone on bone, like a knee,
Yep.
which is me, and you don't have any pain, just the stiffness, can exercise and therapy give you increased range of motion? You only get about like 75%.
Yeah, absolutely.
Still get range of motion improvement?
Absolutely, yeah, and we'll get into that a little bit with the conservative treatments, but the main purpose of the therapy is to make it functional, right? So physical therapy, really any conservative treatment for arthritis is not going to change the arthritis, right? The arthritis, once it happens, it's there. There's no reversing it. Rheumatoid arthritis, some of the other ones, there's medications that can help lessen flare-ups, but osteoarthritis, that true breakdown of the cartilage, it's bone on bone, the cartilage, so that breakdown, that bone's not going to heal again. But through therapies and stuff, you can regain motion. You can get better motion. Yeah, absolutely.
More degree range of motion, really.
Absolutely. Yeah. There's definitely treatment options, and we'll get into that a little bit more. Some specifics I'll talk about. So this is a X-ray of some knees and some degenerative changes over time. The number one way to detect arthritis, osteoarthritis, is through X-ray. The X-ray of the joint. So this is a knee joint. So that first picture up in the top right is pretty much a normal knee joint, right? That's considered grade 1. Grade 0 would be absolutely no chance of arthritis. That first joint, unlikely that arthritis is the cause of this person's pain, being that you have that nice clean joint space, plenty of space through there. Number B, or letter B, you see some little more whitening. The joint, you don't have that clear black space in between it. Now we have mild arthritis in that joint. It's more on one side. It's not very severe. Coming down to the bottom right, a little bit more of that sticking up, some bone spurs in there. Now we're into some moderate. And then coming over to D, we have severe, where that joint, there's almost no space over on that left edge. So some related changes, other things in the body that happen alongside arthritis. Number one is it's associated with other joint injuries, right? So if you have a history of a joint injury or a meniscus injury in your knee, a surgery, something like that, you're going to be at a higher risk down the road. There are studies coming out now showing that people that had, say, an ACL injury in their mid-20s, right, and they had a surgical repair of their ACL, they're coming back about 10 to 15 years later, they're developing some arthritis in that joint. Most likely that's because of an instability in the knee and some different inflammatory responses that happened during that surgery that are causing the arthritis down the road. The decreased joint position sense. So this leads right into the next one of a risk of falls. So your sense of space and knowing where your arm is when you reach it out is called proprioception. Big word. All it is kind of your position sense, right? I know I put my hand up here. I know where it is, right? As the joints start to wear out, there are receptors in that joint that will wear out, and you don't necessarily have a sense of exactly the angle that your elbow is bent at. If you have arthritis in your elbow or your knee, you don't know where your knee necessarily is. The good news with this is there's been studies that show just putting a compression sleeve on. That's why a lot of people, they have arthritis or something and they feel that a compression sleeve on their knee, say, helps them walk better, they feel less pain. It's because what that does is that applies some pressure to the joint and it helps stimulate what receptors are left in the joint. And there's some studies that show there's about a 40% increase in joint proprioception with just an elastic sleeve on your knee. So when we don't necessarily know where our knee is, right, we're then at an increased risk of falls, which is not good. That's the number one thing for physical therapy is prevent future falls. Also, increased your weight plays a big role in it, both leading into arthritis and when you have arthritis. So every 10 pounds you are overweight, it's estimated about 30 to 60 pound increase on the joints, of force on the joints. So if we're only 10 pounds overweight, that's not too bad, but now that's 30 to 60 pounds more that we're now carrying around of force through our joints when we're walking. What can happen is you can kind of fall into a cycle where my joints hurt, I don't want to get up, I don't want to move, so now you're living a more sedentary lifestyle, what can lead to increased weight, which then we're walking, there's that more increased weight. So we can kind of come into a bad spiral that we want to try to break early on.
The 2.5 and 3 times a day you said on the knee, that's mostly felt while you're standing up and going down.
Even just walking, but yes, it's an increase when you're either going up or downstairs as well. Yep. And then if you're running, that's an even higher increase because now you get airborne, so gravity plays a role into it. Let's make sure I didn't miss anything. Good. All right. So some conservative treatments. Physical therapy is low on the list. I should have put it number 2. The other 3 aren't as great. So number 1 is weight loss. If you're overweight, or even if you don't really think you're overweight, losing some weight definitely takes pressure off the joints. So weight loss is the number 1 conservative measure that doctors use. Talking about glucosamine and chondroitin, 2 over-the-counter supplements, vitamins that are very common. We get questions about it all the time. Unfortunately, the research is not great to support them. There was a really good study done a couple of years ago that showed that there was no difference in pain levels or any changes in the joint. Whether, ideally they're saying that they can help regain some cartilage growth, that they'll stimulate the cartilage growth through these glucosamine and chondroitin are the enzymes that help build cartilage in your body naturally, but there's no evidence showing that taking supplemental is increasing that. There are a couple of studies out there that these companies use that show these people have less pain, not that there's a increase in the cartilage in the joint, but those studies tend to have really small population sizes, which doesn't make it as great a study, versus the ones that show that it doesn't do too much are what are called meta-analyses or systematic reviews, where they take all the research that is out there, a bunch of research articles, and compare them all and take the results of all those.
Maybe probably more logical to eat chicken cartilage.
Perhaps. Anti-inflammatory drugs, really good at a temporary decrease in your pain, your swelling. Not going to do anything for you long term, and there are bad side effects of taking those long term, especially for your liver and your gut. So long-term use of anti-inflammatory drugs isn't great. We'll talk about diet, then we'll talk about physical therapy. So there's some diet options that have shown to decrease what's called the C-reactive protein, which is a marker for inflammation in your blood. So that these foods tend to decrease just inflammation in general. And those can include cold water fish, olive oil, beans and nuts, oatmeal, green tea, fruits and vegetables. And then you want to avoid any processed foods, and high salt foods can have that negative effect where it actually increases that C-reactive protein. And the reason why it increases is that because fat can produce the chemicals, cytokines, that lead to the breakdown of cartilage. So that excess fat in your body can actually lead to a breakdown of the cartilage as well. So that's all negative stuff. Let's talk about some positive stuff. So physical therapy. Through the use of exercises, stretching, joint mobilizations, there's some taping techniques, and then we use modalities as well. That's your ice, heat, TENS units, and ultrasound. Can all help decrease your pain, but it's really those exercises and the manual therapies that help move the joint better. You were asking before about regaining range of motion. More range of motion, yeah. TENS that you see increased range of motion, right? And that's just from decreasing the swelling, decreasing some of the muscle tightness around the joint is going to help increase that joint, and just decreasing the pain in general. What we don't really do is you don't really want to force range of motion with arthritis, right? If you have a hard block where it's a hard block, and this is particularly in shoulders, we see this a lot where the person's just not able to get up there, and cranking on that joint isn't going to improve anything. I can crank them up here and put them in 8 out of 10 pain, but is he then able to get up and reach overhead and grab the dish from the top cabinet? Probably not. So we focus more on function, right?
Is it something you have to do every day, or is it something 2 or 3 times a week? Okay, so it's going to be every day, like brushing your teeth. You got to do that every day with the exercise.
Yes and no. So there are, typical course of treatment for physical therapy is, and this is what your doctor would write on a prescription, is 2 to 3 times a week for 6 to 8 weeks. That's your typical PT course. Different facilities treat differently. Our facility, we tend to see patients 2 times a week, sometimes 3, depending on the injury. 2 times a week you come in, you do your manual therapy, you're guided through your exercises, and then there's always a home program part of it. And that home program is the exercises that are super important for you to do. I like my patients to do them daily. Not everyone's able to do them every day, and it doesn't necessarily have to be every day. But keeping that short, right? Something you can run through in bed before you get up to loosen your joints up. Something maybe 5 to 10 minutes of 3 to 5 exercises that you need to get your knee joint moving correctly. That when you get up, it doesn't hurt right away. No problem.
I have
Yeah.
a question. We have a TENS.
Okay. Yep.
Where would you put the leads on a leg when his knees are hurting?
Yeah. So TENS units,
They just work a little bit.
right. So what they do is they trick your brain. By putting the leads on and you feel that tingling underneath the TENS unit. If anyone doesn't know what a TENS unit is, it's an electrical stim unit with leads that go on your legs, and it generates an electrical current that you tend to feel as a tingling. There are different uses for it, but
We use it on his back.
on his back, yeah, it's really
Knees
common
are
with his
really
knees.
bothering
Yeah,
him, so I
I'll
thought-
talk to you personally, and
Okay.
we can discuss that later. Any other questions so far? Doing okay? Good. All right. So when those original conservative treatments fail, you have joint on joint. You have joint on joint grade 4 arthritis. You tried PT. It's not getting any better. You're really limited in your daily life. Your functional level is way down. Joint replacements are kind of the last resort. The good news is they're awesome. The way that the technology has advanced and the surgical procedures have advanced, they've become very good at getting them done safely and effectively. And the rehabs after them really aren't as bad as people think. The number one thing my joint replacement patients tell me is, I can't believe I waited so long to get it done. So there are different types. We'll talk about a hip, a knee, and a shoulder. And they all consist of a plastic component and then a metal component. So typically it's a hard, high-density plastic on one end and then a metal ball on the other end for that to articulate on.
Question,
Yeah.
Before you even go for a joint replacement surgery, aren't alternatives available where they can arthroscopically go in and?
Yes and no. So they can go in. They can, depending on what it is. There are other surgical options. They can go in. They can, if it's a shoulder, they can kind of clean out any bone spurs or anything in that joint, which could help. In the knee, they tend to go in and they won't necessarily clean up the joint itself. They clean up the meniscus. So the meniscus is a piece of cartilage different than that hyaline cartilage on the bone, and that tends to be torn as well. So they can go and they can clean that up. They can clean things up. Tends to work for a little while, but that arthritis is still there, and it tends to kind of still progress. Right, yeah, and typically they'll do that in a younger population that has arthritis. Someone in their 40s to 50s, even 60s, they might go in and kind of clean it up first. And what it does is it buys time. So it.
So you don't last forever.
Yeah, the joint replacements unfortunately don't last forever. Typical lifespan on the joint replacements we're seeing right now is 20 to 25 years. The good news is in 20 to 25 years from now, the technology is going to be way different, and I think surgical procedures are going to be different as well.
I read some article that they were not recommending it for younger people because of just probably the thing you mentioned.
Exactly.
Unless it becomes absolutely necessary.
Yeah, and you do see it. We see particularly hip replacements in a younger population, in that 30 to 40 range, which is young for a joint replacement, just because it gets so bad. But another thing is, if we can prevent it, the technologies are advancing quickly that, down the road, you might have some better options than a joint replacement.
I think I read also that elsewhere in Europe and all that,
Mhm.
they do kind of like, before you even go for a joint replacement, they go inject certain.
Yeah. So that's not in here, but that's a good thing that's a good point to talk about. So that's another conservative treatment is injections that I didn't talk about. So you have a couple types of different injections. The most common one is cortisone, which is an anti-inflammatory that they inject directly into the joint. Helps with swelling. Tends not to be so great for arthritis. It's good for a short-term relief of pain, kind of same as the oral anti-inflammatories that we talked about. The benefit of that over the orals is that it's directly into the joint. You don't have the effects on your liver or your gut because you're not taking it orally, and it's directly into that joint. They also do viscous injections, which is like a gel injection into the joint. And what that does is that will force some space through the joint. By increasing the viscosity or the how thick the fluid is in your joint, they can help kind of separate it out a bit. Mixed results on that. Studies are out whether or not that's playing a big role or a functional role overall. From anecdotal experience.
Tried on a large scale in US.
Right. Yeah. From anecdotal experience, it's actually more common in the U.S. than you think. It's rather common. Actually, it tends. It's again geographical. Like you said, Europe's really popular. When I was working in New Jersey, it was much more popular than it is in the greater Boston area. It's just different doctors do different things. Tend to see mixed results. Number one thing is insurance doesn't pay for it 90% of the time, and it's expensive to do. And it typically takes 3 to 4 injections before you start to see any results, so it gets very expensive. A lot of people will opt for the joint replacement that the insurance covers, where insurance isn't covering these because it's still considered experimental. Got some pictures of joint replacements. So the first one up here is a hip joint. So what they do is they take your thigh bone, they cut the top off, they slide in the metal rod, which has the ball on the end, and that's your new hip. On the other side, on your pelvis, they slide a new socket in. They'll clean up what's ever there, and they slide in a metal socket with a high-density plastic inside of it, and it goes right back in, ball and socket joint. Rehab for that tends not to be very painful. You get some pain on the incision because they do have to make an incision. There are new procedures coming out where they're now making a small incision, and you don't have to cut through as many muscles, so you don't have what are called precautions after it. Certain ways you're not allowed to move your hip, just while those muscles heal back up. Coming over here, your typical knee replacement. So this is a full total knee replacement where they kind of take your shin bone, they cut the top off of it. Same thing, high density metal on that, high density plastic on that side, and then on the top they kind of cup over where that's all worn down with a metal edge, and now you have a nice smooth gliding surface. They are starting to do what are called hemi-compartmental procedures where they'll only do half. So if, say, it's just the inside of your knee is wearing out, they can go in there and they'll only replace half the knee joint, which tends to be really good. A lot of times people only have that breakdown on one side for whatever reason, be it the way they walk, something like that, where they're getting wear only on mainly the inside of your knee is tend to where it wears out more, and you have great success with those. Down on the bottom, you have your shoulder replacements. So there are 2 types of shoulder replacements. The first one is your standard, where they, like all the other ones, they keep the standard anatomy of your joint, your shoulder joint. So your shoulder joint is a ball and socket. Your arm bone and your shoulder bone, your arm is the ball, the shoulder is the socket, right? And it sits right in there. Normal replacement, they'll keep that anatomy. They'll replace the ball and replace the socket. And then they have what's called the reverse total shoulder, where they actually flip the ball and the socket. So they make the shoulder part of your joint, or the shoulder blade part of the joint, the ball, and now your arm is the socket. The reason why they do this is because it changes the fundamentals and the kinematics of how your shoulder moves, and you no longer have a need for a rotator cuff. So if you have a history of a rotator cuff tear, or your rotator cuff is torn and you have severe arthritis, they're tending to go towards this reverse shoulder replacement because they don't need to repair the rotator cuff. They can just forget about the rotator cuff. You don't have to worry about the rehab after that. And you just focus on regaining your motion and your strength after the shoulder replacement.
These probably put limits on what activities you can do. Like you can't go in for abs.
Surprisingly, no. I've seen total shoulders, even a reverse total shoulder, where you're thinking, oh, well, I don't have a rotator cuff anymore. How am I going to reach over my head or swing a golf club? But I've had total shoulder replacements. Return to golf as normal. I've even had tennis. Most of the time, people return to normal activities. Are you going to be pitching for the Red Sox? No, but
Hang gliding.
hang gliding you can probably get away with. All right, so let's talk about some prevention. So we all talked about all the bad things. There's ways to prevent it, right? So some just general kind of tips and tricks on how to keep your joints nice and healthy. So normal, first one, regular exercise. So general regular exercise, 15 to 20 minutes a day, if not more. Moderate exercise tends to help. We want to stay with low impact activities, which we'll get into. The next slide will break down what a low impact activity is. The reason why we want to do that is because it puts less force on the joint, right? So running is a high impact activity where you're constantly pounding, but riding a bike is non-impact where you're not pounding at all, you're just cycling. And then an elliptical is also low impact. Proper lifting techniques. So, how do we bend down to pick something up off the floor, right? Are we bending? This is particular for spinal arthritis, right? Are we bending from our back, or are we bending down from our knees to lift something up correctly? And then stretching, just keeping your muscles loose and moving the way they're supposed to. Hydration. We are made up of 90% water, so staying hydrated keeps our muscles and cartilage and other tissues moving the way that they want to. As we start to dehydrate, the fluids in our knee aren't moving as much because the water is kind of getting sucked out of that because the body's trying to find water from elsewhere. Kind of a tip for arthritis is, for hydration is once you feel thirsty, you're already probably dehydrated, right? So it's about kind of getting your normal, intake of water throughout the day. A good dehydration test is kind of just grabbing the skin on the back of your hand and pinching it. It should kind of go right back down. If it kind of hangs out and goes slow, it might be a little bit dehydrated. All right, so some exercise recommendations. So first off, let's start with just some benefits of exercise. So the American Academy of Sports Medicine, based on moderate exercise for 150 minutes a week, which is not as much as you think per day. Benefits include improved cholesterol levels, both increased good cholesterol and decreased bad cholesterol, reduced blood pressure, reduce in total body fat, increase in insulin sensitivity, which is a good thing, improved bone health, improved postural stability, decreased fall risk, and then improved range of motion and flexibility. And that's just with general moderate exercise. And then just generally staying active, not even according to that 150 minutes a week. Active individuals have a reduced mortality rate, lower risk of colon cancer or recurrent breast cancer, reduced risk for developing Alzheimer's, reduced incident of heart attack and lower rate of strokes. You also have a lower risk of developing type 2 diabetes, and it's an effective treatment for type 2 diabetes as well, just regular exercise. And then decreased depression. Overall, increased activity in elders leads to improved functional capacity and improved quality of life and independence. So some recommendations. Cardiovascular activity, moderate aerobic activity. So this is your walking, your cross-country skiing, biking, swimming, at least 2.5 hours a week. And then strengthening, that doesn't mean you have to go to the gym and bench press and squat. At least 2 days a week of strength training for major muscle groups. And these are according to the CDC. So cardiovascular training. So low impact activities is swimming, cycling. Cross-country skiing is also a low impact activity now that we're getting into winter. High impact activities is your jogging, running, jumping, are all high impact where there's a lot of force through your joints. So those are not recommended.
Skating.
What was that?
Skating.
Roller skating? Yeah, that's
Ice skating.
ice skating. Yeah, you had an increased risk of a fall with that, which isn't always a good thing. But if you're good at it, it's considered a moderate impact, right? So a little bit more than your general walking because you tend to really have to push off, but you're not running. So it's a moderate impact activity. So what is that moderate activity? So it's kind of we're working up a sweat, we're not exhausted. Best way is kind of target heart rate. So wearing a heart rate monitor, a lot of times all the new smartwatches, you put in your weight or your phones, and that will tell you what your target heart rate should be. A way to calculate it is you take your resting heart rate so be it from your wrist or your carotid. And then it's your resting heart rate, and then there's some math in there. It's essentially you're looking at 60% of your max heart rate. Max heart rate generally is calculated by 220 minus your age, so how old you are. That changes if you have a history of any cardiovascular events. So if you've had a heart attack, if you've had heart surgery, that can change. So definitely contact your doctor if you're going to use heart rate for kind of determining your intensity.
So,
Yep.
are you supposed to get up to that level? And maintain
Yeah,
it?
so that's a maintainable level, right? So that 60% of your max heart rate is typically you can go out and you can walk, or you can hold a conversation while doing that activity. All right, so what we're going to go through now is just a couple different kind of techniques for you guys to take home. And if anyone wants a copy of this PowerPoint, in the back there's our sign-in sheet as well. It says complete game at the top. Just give me your email and we can send that out to you. So first one is just 2 stretches. I'm not going to demonstrate both of them because one you have to lay down for. So one is just stretching your glutes. And as he's doing, you kind of just lay on your back, cross your leg over. Or you can even just do it sitting in your chair. I'll demonstrate these. So it's just keeping your lower body nice and loose. So the first one, a glute stretch, you're just going to, I sat on the mic, you're going to cross over your leg. You kind of just put some pressure down there and you'll feel that stretch right in your butt. Typically for stretches, we like to hold them, 30 seconds, about 3 to 5 sets. Or you can do a prolonged hold on them as well, about 2 to 3 minutes. Typically for arthritis, you're looking more for just some mobility through the tissues, not necessarily increasing the length. So that 30-second hold 3 to 5 times is sufficient. The next one up there is a hamstring stretch. So that's the back of your legs. This one's really good for knee arthritis. So you're going to go leg nice out and straight in front of you. You pull your toes up to your face, up nice and tall. And you just lean forward. You'll feel a pull right in the back. Same hold on that. You can demonstrate from the side perhaps. Legs right out in front of you, right in that section picture there. And you just lean forward. You can add a strap onto your foot, pulling up on your toes. Will kind of help that one as well.
Picture that you have over there.
Yep.
I've seen that from piriformis stretch.
Yep, that's what that is. That's the piriformis stretch. Yeah, so glutes, piriformis. Yep.
You get better, but then I go back and sit in the car seat and it aggravates it again.
Yeah, so this one's really good if you're sitting a lot, that piriformis stretch. All right, so some strengthening tips. So we got 2 that are easy to do at home, a chair squat, and then leg lifts in various directions. So for the leg lifts, he's going to demonstrate and I'm going to demonstrate with a chair. I prefer to have people do it at the kitchen counter because it doesn't move. The chair can move out from under you. So different directions with your leg lifts. So if you're standing right at the kitchen counter, up nice and tall, a couple of them you're looking at coming to the side, up nice and tall. Number one thing you see with that is people leaning way over, thinking, I'm going to get my leg up higher and we're going to strengthen it more. You're going to compensate, you're going to hurt your back. So standing up nice and tall, and you only have about 30 degrees of motion there. Typical sets for these, you're looking at sets of doing 10 lifts and switching to the other leg 2 to 3 times on each leg. You can also go straight back in that position, or if you're standing to the side, you can kick forward. So 3 directions. Next one is a chair squat or a sit to stand. You just take a regular standard chair with or without arms. If you're having a little bit of difficulty, you can start with some arms on that chair. Just sitting down, you scoot to the front of the chair, and then the cue for this one is you want to get your nose out over your toes. So when you kind of come forward, you want to lean forward, get that nose way out over your toes, and what that does is that starts your motion, right? So it starts, my butt's already up off the chair, I haven't used any muscles yet, and you can stand up tall. And then you're going to come back down nice and slow, and then nose back out over your toes. Same thing, this one I would start with maybe 1 set of 10, build your way up to 2 to 3 sets of 10. Yeah?
Now, if you have a sore knee, is that helpful for it, or is it strengthening it, or is it putting too much pressure? That's what
It depends. It depends. Yeah, every case is a little bit individual. If you're trying these at home and you're having increased pain,
No pain, if there's no pain.
no pain when you're doing it, it's a good thing.
Okay,
Yep.
all right.
Yeah,
It's pain.
absolutely. If there's, generally, and I should have mentioned that with the stretches. Generally, exercises and stretches should not be painful. If you have any pain with any of these exercises or any of the stretches, or just your exercise program in general that you do, you should not have pain when you're exercising. All right, so some arm exercises. A little bit easier. So the first one down here in the corner are some rows. She's using an elastic band. At the gym, they have the kind of cable column machines. The bands you can get really cheap. Most sporting goods stores will have them. I think even CVS carries them, or online on Amazon. They're really cheap and you can get them in 2 days.
Don't they come in different colors for?
Different colors for different strengths, yeah. But the good thing about that is you can adjust how much tension they're going to give you just by how much tension you start with it on it. So the first one is a row, so arms are right out in front of you. You're just pulling back to your side. Working on strengthening both your shoulders and your shoulder blades. This is a really good postural exercise for getting your shoulder blades back in a good position. Gripping exercises, he has that standard, boxer gripper or rock climbing gripper. You can take a stress ball, you can roll a towel up, just kind of squeezing and relaxing, working on both hand and forearm strength. This is really good for that hand arthritis, right? That joint stiffness, just grabbing a stress ball and kind of just working through that. Last one is arm raises. Again, we have different directions like our leg lifts. So she's going straight up in front of her. And you can all start these with no weight. And then you can go into V's or straight to the side. So kind of 3 directions for that one. Same thing as the hip in both 3 directions. Any questions on these ones? Yeah.
I want to know the lady that's pulling like.
Yep.
What if you put it over the door and you're pulling like this? Is that better, worse, or
It's similar exercise.
are you getting the same benefit or you're not?
Yeah, same benefit. Still strengthening your shoulder blades. Yeah. There's various ways to do that are all kind of similar to the row.
Thank you.
No problem. So last one, some other activities. I've done a couple lectures at the Chelmsford Senior Center as well. And I know that they have some really good classes as well as a fitness center there. Their Bone Builders class, which isn't on here, is a really good just general fitness class for the aging population. You're not up against all these other people who go to the gym 10 days a week. Also yoga. Yoga is really good for your joints as well as balance. And then the biggest thing now is Tai Chi. The Asian martial arts, I guess it is considered. But that's great for balance. Yeah, there you go. Mind, soul. But that's really good for balance and general strengthening as well because you're moving in these specific motions. And there's some studies that show that Tai Chi classes are actually helping with some Parkinson's patients as well to help control that. And that is all I have. Are there any questions?
Does weather play a role in arthritis? Because if you talk to your PCP about it, it says that most Americans in this country have arthritis. It says it's related to the weather.
So it's not that arthritis is related to the weather. So it's not that the weather is affecting the arthritis. There are some theories out there, not proven, and there's debate on whether or not there's a true connection there. But people can say, "Oh, my knee's really sore today," or my shoulder's really sore today, and it's because of the weather, or it's going to rain later because my knee's sore.
Because I've heard that the rain makes it worse.
Yeah, so what it is it's a change in the pressure, right? So when it's going to rain, the barometric pressure of the atmosphere changes, and your joint senses that change in the pressure. Is there truly a connection there, or can they prove that that's an actual connection? They can't seem to figure out why that happens, but you talk to people all the time, and that's what they tell you. So there's no connection. And it's not that it hurts because of the weather, or that it shouldn't hurt regardless, right? So if your doctor's telling you it's because of the weather.
So that's the way she put it.
Well, what happens in
Why are you complaining?
cold weather? I mean, the muscles are contracting.
Yeah. So cold weather is a little bit different. So cold weather, or when it's cold out, your muscles tend to contract, and it's just the body tends to contract because it's trying to keep itself warm. So by the muscles can contract and it helps generate some body heat and keep in some of the heat. So you can definitely feel stiffer when it's cold out, but it's not necessarily the cause of your arthritis or the cause of your pain.
Maybe it's the degree of the pain.
Yeah, your degree of the pain
Worse during that.
can vary. Yeah, absolutely. Jim.
What's your comment on doing exercises in the pool?
In the pool. Pool exercises are really good. We talked about swimming on there. If you have access to a pool, I know you can get a pass to, I believe it's the Radisson sells a pass, you can use their pool. Pool exercises are really good for arthritis because it takes pressure off your joint, right? So maybe you're not able to do a chair squat, or a leg lift outside the pool, right? But now you get into water, and based on how deep you are in the water, you have a decreased amount of body pressure, right? So if you're halfway in the water up to your waist, you have a 50% decrease on pressure on your joints below the water. If you're up to your neck, it's a 90% decrease in water. So if you're kind of just floating in the water or holding up at the side, you can go through all these exercises and you have absolutely no weight on them. You can also then use the water. Now we don't have any pressure on the joint, but the water can provide some resistance. So now we're actually strengthening, not only just moving through that motion.
You can do balance exercise too.
Yeah, the balance helps as well in the pool. You're not gonna fall over.
I get affected by piriformis muscle
Yep.
strain because for decades I was carrying my wallet in the back pocket, right? So obviously that started it.
Mm-hmm.
But now, even when I do exercises for the piriformis muscle, it provides some relief. But you go back and sit in certain car seats or whatever, especially when you're driving,
Mm-hmm.
and your leg has to be extended out,
Yeah.
I can get it back again.
Yeah. So the piriformis syndrome or piriformis muscle pain, it's hard to differentiate between true piriformis syndrome and sciatica or something that's coming more from your low back, truly your low back, where that muscle might tighten up and you can loosen it up, but what's causing it to be tight in the first place? And there are various muscle imbalances that are causing it to tighten up in the first place, and a full evaluation can help with
I
that.
can feel it where the muscle seems to be stiffer.
So yeah, absolutely, where it seems to be stiffer, but like you said, there's always a cause. Like for muscle stiffness, there's typically some sort of imbalance or malalignment in the body somewhere where excess force being put onto that's causing that muscle to tighten up.
Because when I'm not driving, I'm okay.
Yeah.
Same
So
seat.
for you,
leg
it's
extension.
kind of leg extension, sitting. Yeah. I don't
I
have.
need a voice actuated gas pedal. And
There you go. Or hand controls. Yeah. Get a Tesla.
That's only in the sedan.
Only in the sedan. Yeah. So.
Only in my Camry that I get.
Right, versus if you're sitting in
I think it doesn't
a
matter
higher
how I
car,
design it.
right? Yeah. So, but if you're sitting in it,
It's more of a problem.
it's more of a problem because you're gonna have more force. You're putting it more on a stretch when you're sitting lower versus if you're up tall, there's less of a stretch through your hamstring and your glute. Anybody else?
I'm gonna drive an SUV.
There you go, or a Tesla, where it drives itself.
So, ganglion cysts, are they cardiovascular arthritis?
Ganglion cysts are separate from osteoarthritis. Typically, you could have some cyst formations, but typically with arthritis, you're going to look more at bone spurs, versus a ganglion cyst is like a different fluid buildup pocket. There's not, a little bubble that tends typically in the wrist, wrists and fingers, but typically not necessarily associated with arthritis.
Is bursitis kind of like?
So bursitis is the inflammation of a bursa, different than arthritis, which is good. So arthritis is the inflammation of a joint. Any itis is inflammation. So bursitis, if you have bursitis of the hip, is very common. Is kind of the bursa, which is a fat pad kind of on the side of your leg, gets inflamed. Versus, and you feel it more on the outside, versus hip arthritis is the breakdown of the cartilage in the hip joint, and most people feel that more through the groin than on the outside of the hip. Yeah. Again, something like that typically because of a muscle imbalance or weakness. Yeah, that glute stretch and the hamstring stretch help with those really well.
So is it true that certain vegetables that you eat, like they say nightshade vegetables, they increase your arthritis pain? They say so you should exclude them from your diet, like eggplant. That's one of them which is considered.
I haven't heard that. I can't.
I got the book from
Right.
the clinic.
Yeah,
and
if
it
it's in the
was
Mayo
that.
Clinic book, then I'm going to
Yes.
go with that because I can't confirm or deny that. So,
I believe for every activity there has to be an equal and opposite activity, just like the action reaction.
yeah.
I bike a lot, and
Yep.
I find out that the neck muscles in the back get overly strong, so that affects your flexibility on like moving.
It
sideways.
could, yeah. So it's all about. So actually, in our clinic, we're 3 therapists now. We actually just hired a 3rd part-time therapist, and we're all cyclists, which is kind of a neat fact. But for that, it's really just posture on the bike. There's making sure you're in the correct posture. Not that it's necessarily bad or it develops different muscles, improperly. It's just about being balanced.
But most of the time, if you stoop way back and then you're lifting your head up to see the road.
Yeah, and it's about being. There's particular ways to do that correctly without straining.
So what can you do about stiff neck muscles?
Stiff neck muscles. I should actually put that in there. I only put the stretches for the lower body, huh? So stiff neck muscles. There's 2. Like if you're working at a desk job or you do a lot on the computer, and pretty much everyone now, we all have phones, or most people have phones, or working on laptops, and we're always kind of in this position, right? So our necks get stiff, shoulders get rounded. Kind of 2 really good stretches. Like those rows, you can step back from the row, and it's just a shoulder blade pinch. So if you watch from the side, just thinking about pinching your shoulder blades together. You can hold that and then just relax. That's a good one. Just get your shoulders open up, get your shoulder, and the neck stretches. Easiest one for most people is just straight to the side, pulling over. And the same hold for that.
When you're
30
looking at your
seconds.
terminal, your head is up front, and the head has got a heavy weight, so the muscle.
Absolutely, yeah. The head is and the neck has to support that, right? And if we're always down here, we're straining the muscles in our back, the back of the neck.
I heard something about after you're sitting for like some certain period of time, you should get up and move around.
Yeah, it's just, generally, if you're sitting more than a half hour, people, you get up, move around. At least, up and down off the chair. Just takes pressure off your spine. What was that?
Keeping hydrated helps.
Keeping hydrated. Yeah, there you go. Double edge. What was that?
If you sit too long, then rigor mortis will.
There you go. Then you're stuck.
But that is good, so at least you go to the bathroom or.
Yeah, exactly. Yeah, that's why. So it makes you get up. I got the joke. In the quack.
I just want to make a comment that I still like to be active and do stuff around the house and stuff like that. And I'm like 78, but I feel like I'm 48. And I've been going to Andy and stuff like that, and he has really helped me out. Achieve doing what I want to do, but I find that the exercises he gives me that I do every day prevents me from getting problems if I start doing things that maybe I should be. So I just thought I'd mention that.
Thank you for that. Any other questions? No? Well, thank you for coming. If you have any personal questions, I'll be up here. I can answer questions. Thanks.